Today we are going to discuss clinical hints, clinical picture of digitalis that I have seen in my last 38 years of practice, mostly in hospital and my clinical practice. It's a very useful remedy, not only in acute cases but also in chronic cases. The most important thing that one should know about digitalis is that it's not a remedy which is very unique for homeopathic pharmacopoeia. Digitalis has been used since hundreds of years in modern medicine to treat heart conditions, and even today digoxin is used extensively in cases of congestive cardiac failure. Looking from the homeopathic perspective, this digitalis is basically coming from Scrofularia or Scrofulaceae family, where other remedies like Euphrasia, Leptandra, Verbescum are used in homeopathy. The plant basically has leaves, and these leaves resemble the fingers, and that is why it is known as digitalis, means like fingers. The juice is extracted, but the medicine is not prepared from the plant for the first 2 years. You want the plant to mature, and only then the tincture is prepared. Now, if you are going to study the pathogenesis, it basically comes from the alkaloid of the plant, digitalin. Digitalin is the powerful alkaloid of the plant which helps to contract or increases the contractibility of the chambers of the heart, be it ventricle or be it atrial. But if you give excess of digitalis, many accidental deaths have been produced because heart went into a permanent systole or a permanent contraction. If you are going to experiment digitalis on healthy brewers, initially the action will be to slow down the heart and pulse, at the same time increasing the arterial tension, thus causing contraction of arterioles. Slowly, if you increase the dose, a time may come when there will be no pulse. A time may come when there will be no contraction of the further heart. So that's the toxic dose. But since we brew usually homeopathic brewings on a potentized remedy, so that kind of danger is not seen. But sometimes in sensitive people, one has to be very careful if you are going to clinically brew digitalis. It was first introduced very scientifically by Hahnemann on 11 brewers, and it's a crossover remedy. So you will find references in chronic disease, and you will also see references in MMP, that is Materia Medica Pura. And this is one such remedy like coffea, like opium, when Hahnemann is talking about the primary action and the secondary action. Primary action, slow down everything. Secondary action, everything is fast. Primary action, pulse is slow, imperceptible. Secondary action, pulse is fast, quick. There used to be a homeopathic physician known as Dr. Ringer. If you read Digitalis, you will keep on seeing the name of Dr. Ringer a lot in chronic disease and materia medica pura. And he has studied the pathogenesis of this particular remedy. And he says that Digitalis acts very nicely in those people who have cardiac problems, basically due to poor functioning of the heart. But the word functioning means poor contractibility of the heart. Where the cardiac tissue is fatigued, tired, exhausted, prostrated, and have no strength to contract on its own. Those are the conditions which Dr. Ringer mentions to Hahnemann, and then Hahnemann mentions to us in chronic disease. This remedy was proved on very few brewers, around 10 to 11 brewers. And most important thing that they could observe during the process of brewing was that most of the brewers had a fear of death. Fear of death and heart problems, they go hand in hand. Normally also we see people with heart disease, they are always afraid of death. Digitalis is a perfect example for this. Fear of death becomes much more exaggerated, especially when they are walking, when they are having a motion, when there is an exertion. In fact, motion aggravates not only fear but even anxiety. And why? Because they feel if I walk, my heart will stop beating. They feel if I walk, I'll have a heart attack. They feel if I walk, I'll have an attack of angina. Another important thing is the mind over heart. Heart and mind are very strongly connected, and that is why disappointment, grief will directly affect Digitalis. So most of the brewers who undertook this remedy for brewing, either accidentally or homeopathically, or they were poisoned, they all became very anxious, nervous and sad, and the sleep was totally disturbed because of discomfort in the region of the heart. Now if you look at the sleep chapter and if you look at the heart, everything related to sleep and heart, you will see the remedy Digitalis, like pain in the heart during sleep, or sleeplessness due to heart problem, or sleeplessness due to anxiety in the heart, pain in the heart, constriction in the heart. You will see Digitalis. So that's very important. Now here you may mistake this with Ignatia, because Ignatia also has got grief and disappointment. But Ignatia is more for superficial cases, superficial condition. Digitalis is more deeper. That's very important. Another important thing is these people are quite reserved, lonely, avoid company, and they try to escape from a crowded place. Every night they constantly have a dreams of falling. That's very important. The self-confidence of the patient in general is pretty low, and hence this kind of failure, being unsuccessful, is very frequent finding. This is mentioned in the Kent's repertory also. But actually the symptom comes from materia medica pura, where there is a symptom mentioned, lachrymose and sad mood about many things for which he was very unsuccessful. That's the symptom. Based on that symptom, Hahnemann prescribed Digitalis to people undergoing depression with heart disease. Now here you have to rule out aurum metallicum. Ignatia is too superficial, Digitalis comes in between, aurum comes in the last. Sometimes I have seen from my practice people who are failure in their life because something what they expected in their life totally failed. So failure of plans, failure of projects, failure of certain situations. As a result, they develop a lot of anxiety for future, and they slowly become introverted. So the time comes when Digitalis patients wants to run away from reality, from actual situations. Why? Purely because of fear of failure, unable to face. Why? Because somewhere in the beginning they had some setbacks, and that has really affected them. So they don't want to face it again. So every project, everything that they do, they always have a fear. Oh, it may not be complete. Oh, I will be failure. Then comes their truly conscious nature. In Materia Medica Pura, it is very clearly written that they have got pangs of anxiety due to their conscious nature. And that's very characteristic of many other remedies. Digitalis is not the only remedy. We have got silesia, another very useful remedy. We have got carcinosin, another very important remedy, where there are pangs of anxiety from troubled consciousness. Tortured by the fear of death, tortured by that my disease is serious and I am going to die. That kind of torture, that kind of emotional insecurity after developing heart disease comes under the domain of Digitalis. And this kind of dream that I explained to you, falling down from their own eyes, because here there is a pang of consciousness, falling down into the water, falling down from a height, falling down from your own eyes, pangs of anxiety, pangs of consciousness. Situation very similar to Thuja. The repertory you will see Aurum and Thuja are 3-mark remedies for this kind of dream. So basically the kind of patients that you are going to see of Digitalis are anxious and nervous. Hahnemann says about scrofulous constitution, especially indicated in people who are elderly, not young children. I have hardly prescribed Digitalis to any person at a pediatric age. In fact, not at all. Now let us see some other aspects which had nothing to do with Materia Medica Pura, but in the last 10-20 years we have seen this, and that is broken heart. Broken heart from disappointment in love affecting the person, coronary arteries, conducting system of the heart, or valves of the heart. So damaged valves, damaged coronary artery, damaged muscles of the heart, especially cardiomyopathies. When I started my practice way back in 79, I hardly used to see cardiomyopathies. Nowadays I get so many cases, 3 to 4 cases in a year. Why? All because of damaged heart, broken heart due to disappointment in relationships. Especially in women. Very rarely I see that the cardiac muscle has been damaged toxically with some infection, with some bacterial infection, viral infection. Such kinds of cases don't come to me these days. Or rheumatic fever. Hardly I have seen in the last 10 years, I have not seen one case of rheumatic fever. Even though homeopathic textbook may write quite a lot, but not seen in the practice. Giving you this basic introduction on Digitalis, let us see some other uses. And then I'll again come back to the main uses. Eyes. detachment of retina. This I learned a lot in Calcutta School of Medicine. The role of digitalis. Stammering. Stammering when due to excitement. Stammering when talks to the stranger. Along with stramonium, digitalis comes up. Then comes pneumonia of old people, or neglected pneumonia. Pneumonia that lingers for days and days together. Think of digitalis. Another symptom which has been frequently confirmed is numbness of the thighs when sitting for a long time, 2 hours, 3 hours in examination, in a movie theater, in dramas, in courtrooms, in aeroplanes. When you sit for a long flight, this happens. One foot hot, another cold. Sleeps on the bed with the head very low. That's another symptom. Cold perspiration over the body, but warm sweat on the palms. See a unique feature. Palms has a warm perspiration. The rest of the body is very cold. I think so. British Journal of Homeopathy, volume number 6 and 21st edition. There's a lovely article on clinical application of digitalis. And it says that digitalis becomes very important remedy when circulation of the body is either primarily or secondarily affected. Now there are many remedies. You have to put the whole snake venom into that group. Snake venom has got a lot of action on that. What does it do in circulation? Produces great arterial tension. So again you have to put drugs like veratrum virid, glonine, spigelia, belladonna, melilotus, amyl nitrate. All this comes with slow and intermittent pulse. This is the first indication. Second indication is dropsy of internal or external parts. So a lot of edema, a lot of swelling. Some authors needs explanation between digitalis and strophanthus, because both this remedy has a similar action, contraction of the heart muscles. Then when do we give strophanthus? When do we give digitalis? Well, in digitalis there is slow intermittent pulse with lot of gastric concomitants. I am going to discuss liver very shortly of digitalis. Strophanthus doesn't have that kind of concomitant. Let us see what are the complaints of the patient and the sensations that you see in the field of cardiology. Cactus patients complain of constriction. Digitalis patient complains of uneasiness, symptom which they cannot explain. Nobody can explain uneasiness. So sometimes they may say, I have got a restless feeling, uneasy feeling. I don't understand, doctor, what is happening to my chest. Then comes a second stage where they feel tightness of the chest. They feel they cannot walk. If they walk, they feel heart will stop. Pulse becomes slow and slow and slow. If he makes an attempt to lie down on the bed and go to sleep, he becomes extremely restless, and suddenly he gets up from the bed, startles, and you ask him why. He says, I thought I fall down from the bed. So here it is not only in the dreams that you see falling down, even patient will complain of that. Respiration will be slow. There will be weakness and numbness of the left arm and left upper limb. and very rarely you will see blueness. I have hardly seen blueness in digitalis. Or maybe those cases don't come to homeopath, so I don't see. Sinking feeling exactly in the stomach after eating. Electrocardiogram shows enlargement of the cavities of the heart or dilatation. Electrocardiogram shows irregular, feeble pulse, soft, slow pulse, and there's a dropping of the pulse every 5th or 7th beat. But most important for me, most important, fear to move. Fear of any moments. If I move, I will die. That is the characteristic. Person is anxious, and important difference between digitalis and aconite, because aconite has also got fear of that. Aconite wants company, aconite wants people around, digitalis wants to remain alone. Let's see the dropsies of digitalis, the cardiac dropsy. Dropsy due to congestive cardiac failure, or dropsy due to left ventricular failure, dropsy due to right ventricular failure. Many times I have treated pulmonary edemas of people with feeble heart with help of digitalis. So what happens? Basically, the muscles are weak. Contraction is poor, so the ejection fraction is very poor. And because the ejection fraction is poor, pumping is poor. Because the pumping is poor, there is congestive cardiac failure. That's how the pulmonary edema comes. But many cases of pulmonary edema I have treated with digitalis where there was no congestive cardiac failure but severe cardiac shock or cardiogenic shock. And why it came? From cardiac arrest. So cardiogenic shock is another cause of pulmonary edema. Sudden dope. And why cardiac arrest? Maybe some embolism in the brain, embolism in the lung, embolism in the heart. Suddenly, think of digitalis. And then, what happens to that cardiac dropsy? The liver will always be enlarged and tender and congested. When you touch the liver, it will be sore for the patient, but your feeling will be hard. Jaundice is frequently noticed in such patients. I still remember a case of Dr. Nash who prescribed digitalis to a person with an advanced jaundice, and the concomitant symptom was slow pulse. Slowness of pulse is extremely important. Sometimes the pulse will be so slow, as Nash writes, about 20 to 30 per minute. Liver is slightly enlarged but hard. There is deathly nausea and vomiting. Deathly means sinking. Deathly means with nausea there is sinking feeling in the stomach, sinking feeling in the heart, as if you will collapse, as if you will be dead, as if you will be totally flat on the bed. That's sinking. Aversion to food, great thirst, putty stools, high colored scanty urine, or sometimes you may also get suppressed urine. The stool may be white, chalky white, bitter taste, tongue is whitish yellow, person is extremely drowsy. Now, don't you think this is an important symptom of hepatic coma and pre-hepatic coma? So digitalis is very useful remedy to reduce the serum ammonia levels, which has increased in such patients. Multiple times in my practice, Digitalis has been useful in my practice for hepatic coma or pre-hepatic coma. I look for deadly nausea. I look for sinking feeling. I look for increased thirst. I look for congested, painful, sore, enlarged liver. These are my things that I use. Then for old people, neglected pneumonia, the expectoration is like a prune juice. Open the repertory. Read the NAS repertory. Prune juice, expectoration, old people, pneumonia, digitalis. Dyspnea from least moment, palpitation from least moment. And then again the common fear. I cannot move. If I move, I will die. Sometimes the failure becomes so strong, the congestive cardiac failure, it affects the head, especially the occiput part and the left side. And the pain goes from occiput to the vertex. That's the characteristic. With the headache, there is a confusion, there is vertigo, and that is typical of the congestive cardiac failure and the occipital headaches. Sometimes there won't be any failure, but sometimes there is what is known as the loss of conduction of electrical impulse in the heart, producing sick sinus syndrome, producing atrial fibrillation, flutter, producing dysrhythmia, missing beat, extrasystole. All this is worse grief, worse motion, worse emotions, worse intercourse, worse any exertion. Feeling will be still the same. If I move, my heart will stop beating. Pulse will be extremely slow. So very important indication of digitalis is heart block. Blocking of the cardiac rhythm that is being generated in the essay notes and has to read all the way to the fibers in the ventricle. So there can be hemi blocks, total blocks, complete blocks. Then comes ischemia. So coronary artery disease, angina pectoris. With this typical fear, slightest exertion aggravates, intercourse aggravates, excitement aggravates. Digitalis has got one more symptom which is described by Lilienthal. Lilienthal says raising the arms aggravates the angina. Now maybe it is because of the exertion, maybe it is because of the motion. Holding the breath ameliorates in angina. Holding perfectly still ameliorates angina. Cardiogram shows complete heart block, partial heart block, right bundle branch block, left bundle branch block, hemi blocks. The first remedy that comes to my mind when I think of heart block is digitalis. What is the concomitant I am going to find in such cases? Nausea, vomiting, clay-like stools, thirst, sinking at the end of the stomach, and constant urge to urinate. That's very important. Kent gives a very important concomitant also. Weakness of the forearm, you will see digitalis. I don't know. I never knew this till I saw that rubric. Weakness of the forearm. So degenerative disorders of the heart, congestive cardiomyopathy, restrictive cardiomyopathy, hypertrophic cardiomyopathy. These are some of the pathological diagnoses that needs digitalis. And what do you see in such cases? Dyspnea, getting out of breath, suddenly in the night, person is lying down. Instead of coughing, he gets up with a fright, as if he is falling down. He startles, and then once he wakes up, the actual breathlessness starts, the actual coughing starts, and there are symptoms of pulmonary edema. This usually happens in the night during the sleep, and he has to sit up. That's the modality. Has to sit up, worse lying down in the night. Remember, that does not come with ischemic pathology of the heart, that comes with the congestive pathology of the heart. There's a difference. With profuse perspiration all over the body, auscultation will show some valvular defect, cardiogram may show some arrhythmia or some heart block, urine may show some albumin, and there can be a typical cardiac cough. Now, what's a cardiac cough? How will you differentiate cardiac cough from a pulmonary cough? Of course, both can have expectoration. There is no peculiar way how they cough, but usually what you see is the pinkish white frothy expectoration in pulmonary edema. Pinkish white frothy. Difficult to bring out in the beginning. So lot of rattling, crepitations on auscultation. That is a cardiac cough. You hardly see any wheezing in a cardiac cough. Respiratory condition, you see lot of wheezing. That's the difference I see. Since we were discussing quite a lot of dropsies of Digitalis, how can we forget a very important remedy which is as thirsty as Digitalis, and that is apocynon. Apocynon also has got sinking in the heart. Apocynon is also thirsty. How will you differentiate? Characteristic is urine. In apocynon, the urine is suppressed, urine is scanty. Digitalis urinates like a horse, copious, involuntary, due to relaxed sphincters, and the skin is dry. Whereas in apocynon, the skin perspires and it's always very wet. The only book that gives you this kind of differentiation between these two remedies is N.M. Chowdhury's Materia Medica. Believe me. Otherwise, to differentiate Digitalis from apocynon in dropsy is very difficult. But you will have to also learn to differentiate dropsies with aurum mat, China, floric acid, chimaphilia, lycopodium. All these remedies are useful for cardiac dropsy. But you need to differentiate. You need to understand. So, when you look somebody's leg or the dependent part and you see that spitting on pressure, okay, that's good. But look at the fingers. If they are clubbed, think of Digitalis. If there is constant urge to urine, think of Digitalis. If there are scanty discharges, think of Digitalis. If there is suppression of urine also, because in terminal stages you get renal failure, and that is why Digitalis is an important remedy for uremia. Remember that. I have not seen gonorrhea of Digitalis, but Materia Medica books mentions a lot. The characteristic finding that you will see, of course it's a book knowledge because I have not seen a case, is the thickened prepuce. There are only two remedies in Materia Medica for thickened prepuce. Of course, I have not seen one, but I can imagine one. That is sulfur and Digitalis as a thickened prepuce. Finally, Dr. Dhaule and Dr. Sarape Kapadia, during one of their seminars, mentioned a lovely case of prostatic induration, prostatomegaly, prostatic problems in elderly treated with Digitalis. That was the first time I came to know The digitalis has got so many symptoms that comes from the domain of prostate gland, especially retention with dribbling. Enlarged prostate, person is having fruitlessly urging and painful dribbling. Throughout the night there is constant urge. It destroys their sleep. Prostate gland gets inflamed. Person cannot sit because of the inflamed prostate gland. And you may see history of gonorrhea. And when you do a PR examination, you will see enlarged prostate. This is all that I have to say for digitalis.